If you're a sports physical therapist and you're working with cash pay patients, or you want to work with more cash pay patients, and you're thinking about what is it that I need to adjust in my clinical approach, I'm going to share with you two things that differ in insurance-based care compared to cash pay patients and how that's going to impact your clinical practice. My name is Chris Garcia. I'm the CEO and founder of Sports Performance Physical Therapy. I'm a residency trained sports physical therapist, and I've been able to scale to 3 cash pay clinics. And I'm here to share a few things that are critical for you to understand when you work with cash pay patients compared to insurance-based care. And you might think, well, I can easily do this with my insurance-based care. I don't understand why it's so different. And these individuals, you have to understand that people are looking for something different anytime that they go into cash-based care. And ultimately, you need to adjust your care with 2 small things. There's a lot of things you can do in your clinical approach, but 2 of the simplest things that you can do right up front is identify who that patient is and what changes or what characteristics change about them when they come to you and how to solve their problems. Number one, their motivation level is massive. These people are coming to see you because they're looking for something different. They've failed other approaches. They're looking for, a final solution to their problem. A lot of them might be complex, or to you, they might be simple, but no one's been able to figure it out because no one's had the time, no one's had the dedication to focus on their care. And that's been the challenge that has led them to you. And so you have to understand that they've failed other places before. So anytime that you're on the initial evaluation or that you're on follow-up visits, you have to understand, what did people not do that this person is looking for now, and that's why they're with you, versus if they've already gone to chiropractic or massage and now you want to come up with the best grade 5 mobilization or the best soft tissue technique. They might have already had that, so they're not looking for what you're good at necessarily. They're looking for something different. So their motivation is very, very high, and you need to be able to identify that these people want fixes or they want solutions just a little bit faster. And the second piece off of that is that these people have a long-term problem. Typically, they don't necessarily just need a quick fix. The best cash pay patients, the best people who have the best outcomes, and if you're really in it for the right reasons, you realize that I love impacting people's lives. Well, the people that you're going to impact the most are the ones who have failed multiple providers in the past, failed surgeries, complex cases, and they might not be chronic pain necessarily, but what they are is people who are searching for something that nobody's been able to fix. Now, the misconception with cash pay is that you're going to have, all these athletes flooding in the door. You're going to have them asking for, a fix right off the field, or they want to get back to sport tomorrow. And those might come and go, but ultimately the patients that will be the best, that you can have the most impact on, are the ones who have had a problem that somebody hasn't solved in 1 year, 2 years, 5 years, whatever that is. And those people are willing to see somebody at a network because they're looking for somebody to trust. And those people are highly motivated and they want a solution. And now you as a physical therapist have to understand, you can't come out running out of the gates thinking that you're going to fix these people's problems in 2 visits or 3 visits or 4. And that's always what I see that people, claim, I'll get you out of pain in 4 visits and fast, not like anybody else. And these people don't expect fast. They want the long-term solution. They're looking for a clear answer. They want clarity. They want direction, and they're highly motivated. Those are my favorite patients. I've been doing this for 10 years in cash pay physical therapy, and I will tell you that most insurance-based care, most young or new cash pay clinicians will make this error, that they will think that this person's just like an insurance, and these 2 things easily separate a cash pay from an insurance-based care. They're highly motivated, and yes, they have long-term problems. They're looking for long-term solutions. When you put somebody who is highly motivated with something that's long-term, typically insurance-based care or in previous settings, you've seen chronic pain or complex cases with not a lot of motivation, right? They're just trying to go through the whole system, maybe find themselves inside a surgery, whatever it may be. This is what separates these people. So in your clinical practice, understand that the person coming in is just a little different, and how you approach these things, these 2 things will make a huge difference, and this has to happen at the initial evaluation. That will set you up for success and help you help more patients just like them. If you like any of this content and you're enjoying it, go ahead and like, subscribe, follow. I'm excited to share and help along your journey to be able to ultimately help more people in your respective communities, whether that's cash pay or not. But ultimately, if you're trying to make a difference with these type of patients, you have to consider these 2 things.